I'm Mike Corrigan, a lead psychologist and analyst on the VitalChild team, and today I'd like to share with you a short tutorial on predictive analytics. Now, I know to some it might sound inconceivable to suggest a new accountability policy actually holds great potential. But believe it or not, when it comes to performing sound predictive analytics, taking the high road to CCWIS might just be the secret to your success. As decades of statistical analysis textbooks confirm, these three main expectations of CCWIS basically reflect the methodological requirements to perform predictive analytics. In other words, if you want to discover predictive models powerful enough to guide your placement and treatment decisions more efficiently and effectively, shortening the duration of services needed, you need to embrace these expectations of CCWIS. I've taught child development, research methods, and statistical analysis for many years. I've also led the investigative efforts of numerous large-scale youth-focused federal and state-level studies. I've taught in the juvenile detention system and have ample personal and professional experience in child welfare. I know you have too many kids in need and not enough families and facilities to find them a safe home. You have limited staff and time available to accomplish the seemingly impossible. You have budget issues, outdated information systems, and fast approaching expensive technology demands coming from CCWIS and the Family First Act. So what is a financially and resource-challenged agency to do? Well, when it comes to discovering predictive analytics that you can rely on to deliver electronically generated recommendations, you need to collect higher quality data, and you need to focus on regression analysis. Why? Because in child welfare, you have no room for mistakes. It is critical the statistical results provided are accurate. And regression analysis, unlike data mining and correlation analysis, can help you more precisely test and determine the probability of your predictive analytics actually providing safe and accurate recommendations, as well as the strength and statistical significance of your most predictive models. As history has documented, relying on dirty data mining approaches has failed time and time again. The mere fact that only a few states have a somewhat reliable structured equation to basically only determine initial risk and safety for placement decisions should be evidence that existing assessments, data collection efforts, and analyses used for CCWIS efforts is not enough to guide future efforts under CCWIS or the Family First Act. It is very important when debating which direction you will go with CCWIS to understand the statistical analysis, the math, behind achieving your hopes and dreams. For example, too often correlational approaches lead to what are called spurious findings, a relationship between two variables that appear to be associated with each other, but actually are not. Just imagine if your future predictive artificial intelligence efforts suddenly started basing your placement decisions on if a child ate butter, or how corn consumption was causing domestic violence. And as for the more recent claims on how artificial intelligence can combine every piece of data you have and somehow create a supposed algorithm that solves all your challenges, well, this is not something most respected stats professors would suggest. In my opinion, when it comes to helping kids, we can't take the chance of putting garbage in and getting garbage out. And we should just remove algorithms from future child welfare discussions. In order to perform regression analysis capable of providing the accurate and comprehensive recommendations you hope your new CCWIS can deliver, in order to discover any predictive model you can trust to ensure your youth's and workforce's well-being, these 6 required assumptions must be met. And by meeting these 6 required assumptions, you can fix your methodological shortcomings of the past, achieve the 3 main expectations of CCWIS, and simultaneously discover sound predictive analytics that are basically going to help you with the Family First Act. So for discussion purposes, let's break these down into 2 categories: data collection and sampling. When it comes to meeting these 4 assumptions and the CCWIS expectation to collect high-quality data, you must use a wide array of standardized, consistent assessments across your systems of care which have documented statistical outcomes establishing the reliability and validity. Because if you don't, and there's a 50-50 chance your data is not consistently measuring what you think you're measuring, or you're using several different assessments to hypothetically measure the same thing, or you are missing critical data related to baseline assessments, outcomes, or variables possibly impacting the outcomes, which we call covariates, you might as well save your millions. Stick with your CCWIS and just flip a coin. And if your current approach does not meet these required assumptions, or your efforts in the past have failed to produce accurate predictive analytics, you might want to adopt technology that comes equipped with the psychometrically sound assessments and processes you need to consistently collect more clean, comprehensive data on each youth, family, and the services and support they receive. Basically, to perform the most accurate predictive analytics possible on a population of our most vulnerable youth and families that many would label as outliers, we have to reduce the redundancy of the information we collect, reduce dirty data and missing data, and try to amass the largest collection of high-quality data we can from intake to discharge. Then we need to perform the analyses on a randomly selected representative samples of clients, agencies, and facilities. This will allow you to study the impact of your services and decisions as they relate to the short and long-term outcomes of your youth and families. Because let's face it, most kids will follow a long and somewhat arduous path across your systems of care, spanning months if not years and touching so many along their way. And if we want to truly become outcomes-driven, evidence-based, we must figure out a way to collect data and monitor each youth's journey from start to finish. This is how you can begin to produce predictive analytics to reach far beyond the initial placement decision and begin to produce predictive models for best treatment and interventions. This is the difference between using analytics to be reactive versus proactive. I've trained more than 85 federal level evaluators, and as a result, I've seen time and time again how not meeting these required assumptions contributed to millions of dollars wasted in trying to discover how we can help kids live better lives. I also have reviewed many of the CCWIS products being marketed, as well as CCWIS systems being augmented in-house for CCWIS compliance. And it would appear many are incapable of helping you meet these statistical and methodological requirements. And like you, I don't want to let these kids down, and I don't want you to waste millions of dollars or decrease the safety of your clients or dedicated workforce. So what does your new CCWIS technology need to better ensure delivery of consistent and accurate information and recommendations? Well, the VitalChild team believes that taking the high road to exceeding these three main CCWIS steps will more than meet these required assumptions to produce consistent and accurate predictive analytics. And to follow is how we designed VitalChild to help you with this. We realize that you already collect an abundance of data, and that current data collection processes might fulfill the need to complete the accountability reports essential to keeping funding, and provide enough to somewhat manage the chaos you face every day. But with so many states dealing with the overcapacity issues to care for the growing number of kids and families in need of help, high turnover rates for those working on the front lines, as well as the sad headlines highlighting children's deaths, missing foster children, and harm being inflicted to caseworkers, it would appear that the current data collection efforts often fall short of what is needed to improve the safety, efficiency, and effectiveness of child welfare efforts. This is why we developed VitalChild's MDYA360 module to reflect a gold standard for 360-degree data collection, analysis, and monitoring the physical and psychological well-being of the youth, as well as the facilities and families they call home. In order to collect high-quality data, we provide you with the tools and assessments you need to collect comprehensive information from youth, parents, and guardians and staff. Our MDYA360's reliable and valid assessments were developed during our research funded by the NSF, U.S. Department of Education, and the Department of Justice. Our processes are focused on putting trauma and meeting the basic needs of children first and foremost. Our vision was to connect all across the child welfare workforce on one platform and provide them with every tool, assessment, and form they would need to get through their days and collect the high-quality data needed to actually perform predictive analytics capable of producing results. We not only wanted to provide child welfare with what was needed to monitor the well-being of youth, but also the level of care and safety they were being provided within the facilities and homes. Because, as you know all too well, you can spend millions trying to treat children, But if they do not feel safe and some sense of belonging, nothing we try to provide will be effective. So how do we connect all across child welfare systems of care? Well, we do indeed need to knock down a few silos. Given a use path across the child welfare systems of care touches so many along the way, new information systems should allow all across the workforce to collect data in order to produce the tailored reporting essential to guiding operational efforts, as well as analyzing for predictive models to better guide decision making. VitalChild accomplishes this by not limiting the use of our software to a small fraction of your workforce. If the goal is to determine what it takes to expedite the efficiency and effectiveness of a child's path through child welfare, we must first closely track and assess these paths in order to collect enough data to start performing regression analysis. We believe that in order to improve the efficiency and effectiveness of services, we must get the entire workforce involved in helping to better understand, discover, and document with data where the youth and families were at the beginning, their baseline measures, how they progressed, what we call formative data, the fidelity of the services they were provided, process data, and the outcomes they experienced, which we call summative data. The goal of VitalChild is to help your workforce increase the strength and scope of high-quality data collection and use this comprehensive information to improve operations immediately, while simultaneously utilizing this data to provide the dependent variables, independent variables, and covariates needed to perform regression analysis, seeking the most predictive models to tell you what is working and not working in your state. Now, before we finish, let's consider how this data collection process is going to roll out and truly pay off. And let's consider what personally tailored to your state's needs should encompass. One thing for sure, you cannot and should not assume that an intervention process or a predictive equation or artificial intelligence that worked in one location can generalize to every location. Services and resources differ across communities, and response to treatment can differ among individuals. So a system or a supposed artificial intelligence-driven algorithm designed from data gathered in Canada or another state truly holds no guarantee of producing consistently accurate recommendations when put to use in your state. I mean, think about it. The outcomes depend on the client and the services they received. And as you know well, even within your state, from urban to suburban and rural communities, the clients and the services received often differ greatly. This is why you need an easily reconfigurable system tailored specifically to your state, county regions, and agencies' ever-changing needs, unique characteristics, and the resources they have available. In fact, while your workforce begins to collect the comprehensive system-wide information essential to meeting the three main expectations of CCWIS and the required assumptions to perform regression analysis, VitalChild provides you with the real-time reporting you need to make more informed decisions. VitalChild provides you with an array of personalized reports tailored to your state's and clients' needs. One of these reports is our Integrated Care Passport, which basically provides you with an electronically portable, real-time, longitudinal summary of each youth or family's history within the systems of care. VitalChild also provides you with the ability to electronically document and generate reports on unusual incidents. And just like the Integrated Care Passport, this feature also can immediately alert all connected to the case to be notified upon any changes or escalation of risk. And like many other features in VitalChild, all this data can be configured to produce automated accountability reports based on whatever schedule your state, county, or agencies need. VitalChild also provides your magistrates with judges' reports to make more informed split-second decisions during their busy days in the court system. The bottom line is that when you share across agencies, a mobile-friendly, comprehensive information system, collecting the high-quality data needed to actually guide operational reporting efforts and actually power the predictive analytics you can count on to be consistent and accurate, well, only then can you really start to feel confident in being outcomes-driven, evidence-based. And when it comes to helping you with the regression analysis, the VitalChild team is more than willing to help. Thanks for listening.